There are jobs in medicine that the medical profession does not discuss in public with the same frequency that it discusses surgery and diagnosis and the grand architecture of clinical intervention. Pediatric oncology nursing is one of them. The reason is simple and brutal. Pediatric oncology requires its practitioners to absorb, on a sustained and unending basis, a weight of grief that exceeds what most human emotional architectures were designed to bear. The children who arrive on a pediatric oncology ward are not there because something straightforward has gone wrong. They are there because something fundamental and unjust has gone wrong, because the machinery of cellular division, which is supposed to produce growth and renewal, has turned against the bodies of people who have not yet had the chance to use those bodies for anything. The wards that house these children are built with particular care toward comfort and color and the softening of clinical severity, because the people who build them understand that the children inside will face enough of what cannot be softened, and that the least the building can do is offer what it can. Before this story breaks your heart and rebuilds it again, please subscribe to this channel, ring that bell, and drop a comment below telling me which town or city you're listening from tonight. I read every single one. Ward 11 at Hargrove Memorial Hospital in Portland, Oregon is this kind of ward. It occupies the east wing of the 4th floor. The walls are painted in a palette of warm yellows and greens selected by a child life specialist who understood that the choice of color in a space, where children spend months of their lives, is not an aesthetic decision, but a therapeutic one. The corridor nightlights run amber, rather than the standard white-blue of a clinical floor. The family rooms are furnished with real furniture, rather than the institutional approximations used elsewhere in the building, actual sofas, actual lamps, the specific effort of a ward that understands that the families of its patients are also its patients. The nurses on Ward 11 are not assigned there by administrative rotation. They apply. There is a waiting list. The people who work Ward 11 choose it. This is the most important fact about the ward, the fact that everything else about it depends on, and it produces a specific culture, not cheerful exactly, because cheerfulness in the presence of what this ward faces would be its own kind of violence. What it produces is something steadier than cheerfulness and more durable, a specific, unbroken attentiveness to the children and families in its care, a refusal to look away from the difficult thing, a willingness to be present in the room with the worst of it, and to stay present through the worst of it, until the worst passes or the worst becomes final, and in either case to remain. Dr. Owen Garfield has been on Ward 11 for 7 years. He is a hospitalist, a physician whose specialty is the inpatient floor, rather than the operating room or the clinic, whose work is the sustained management of patients over the course of a hospital stay rather than the episodic intervention of a specialist coming in from outside. He chose pediatric oncology hospitalist work for the same reason the nurses chose Ward 11, deliberately, from a clear-eyed understanding of what the choice involved and a conviction that the children deserved a physician who chose to be there, rather than was placed there by the mechanics of a rotation. He works nights. He chose nights for the same reason he chose the ward, because the nights on Ward 11 are when the ward is most itself. During the day, the floor carries the traffic of specialists and family members and child life coordinators, and the productive noise of a ward managing the clinical complexity of its patients. At night, it becomes something else, quieter and more concentrated. The specific intimacy of a floor stripped down to its essential people, the children, their families when family is present, the nurses, and Owen, doing the essential work without the overlay of the institution's daytime performance. He has, in 7 years of nights on Ward 11, developed a relationship with the floor at 3 in the morning that he would struggle to explain to anyone who had not worked it. He knows every room. He knows which radiator in the family lounge produces a sound at 2 a.m. that is somewhere between a knock and a sigh, and which corridor lights are scheduled to dim after midnight, and which of the nurses prefers to give difficult family updates herself, rather than involving him unless the clinical picture requires it, and which child in which room is likely to be awake at 4, and which is likely to be awake at 2, and what each of them needs when they are awake. He had, until recently, believed he knew everything that happened on Ward 11 at night. The reports from the children began in September. They came in the form of the casual, matter-of-fact statements that children make when they are reporting things they consider ordinary, delivered in the same register as telling you what they had for breakfast or what they watched on the tablet before bed. Room 408, Abena, age 9, in her 8th month of treatment for a Wilms tumor that had required 3 surgeries and was finally retreating. Abena told the morning nurse that the lady had come again and had told her the beads in her hair were beautiful. The morning nurse had smiled and documented it as a pleasant dream and moved on. Room 412, Marcus, age 11, a veteran of the ward by the standards of pediatric oncology. 16 months in, a lymphoma that had gone and returned and gone again, and was currently in a state of armed truce with the treatment protocol. Marcus told Owen on a Tuesday morning, with the specific directness that 11-year-olds deploy when they have decided to tell an adult something they are slightly uncertain will be believed. The lady who comes at night fixed my IV line. It was pulling on my hand, and she fixed it so it sat flat. She has cold hands. Owen had checked the overnight nursing notes. No staff member had documented an IV line adjustment in room 412. He had noted this and had not yet decided what to do with it. Room 415, Priya, age 7, a small and extremely serious child who was fighting a medulloblastoma with a focus and personal dignity that the entire ward found privately remarkable. Priya had shown Owen a drawing she had made, a figure in blue, beside a bed, with yellow hair the color of the yellow in her crayon set and round blue eyes. She had labeled it with the careful letters of a child who had recently learned to write, and was proud of each one, Lily. "That's her name," Priya said. "She told me. She said her name is Lily and she used to work here." Owen had looked at the drawing for a long time. He had kept it. The first time he saw her himself, he was at the medication cart at the junction of the north and east corridors at 3:19 a.m. He had been in the middle of updating a chart. The specific administrative work of the deep night that fills the intervals between patient checks and is one of the reasons physicians who work nights develop the ability to write accurately, while 90% of their attention is elsewhere. He had been writing and simultaneously listening to the ward with the ambient attention he always maintained, cataloging the sounds, a child coughing twice in room 406, and then settling, the radiator in the family lounge beginning its 3 a.m. soliloquy, the specific quality of the building's silence at this hour that was not empty but full of the breathing of small people who were fighting very large things in their sleep. A door had opened, room 413. The room was occupied by a 4-year-old named Tomas, whose ALL had responded well enough to treatment that there was, at current trajectory, a genuinely good prognosis attached to his file, but who was in the 4th day of a post-chemotherapy stretch that had left him feverish and miserable, and unable to sleep for more than 40 minutes at a time. His mother was with him. She was always with him. A small, fiercely attentive woman named Rosa, who had not slept properly in 11 weeks and who Owen felt a private and professional admiration for that he would never say aloud, because saying it aloud would require him to acknowledge how often the parents on ward 11 were the bravest people in the building. The door of room 413 opened, and a figure stepped out. Pale blue orderly scrubs, blonde hair pinned back with 2 clips on the right side. A woman in her late 20s with the specific quality of movement that belongs to someone who has learned the geography of this floor so thoroughly that they navigate it in the dark without needing to think about where they are going. She turned left, which was toward the medication cart, and toward Owen, and she was 12 feet away from him before he processed what he was seeing. He had no memory of an orderly being scheduled for Ward 11 tonight. He watched her move down the corridor. The corridor nightlights ran amber along the baseboard. Her feet were in the light. Her shoes, the standard, non-marking soles of hospital footwear, should have produced a shadow angled forward from the light source behind her. He watched the floor ahead of her as she walked. The floor ahead of her was clean and unchanged. No shadow preceded her. She stopped at the medication cart, 2 feet from where he stood. She looked at the cart for a moment, not checking anything on it, simply looking, with the expression of someone registering that an object is in its expected place. Then she raised her eyes and looked at him. He had seen a great deal on Ward 11 in 7 years. He had sat with parents as they received the specific, devastating news that the treatment had stopped being enough. He had been present at the end of lives that had not yet fully begun. He had held together in the face of things that tested the limits of what holding together means. Her eyes were blue. They carried in them what he had seen in the eyes of every person who had worked this ward long enough. The weight of it, the sustained accumulated weight of caring for children in the worst circumstances, the specific gravity of someone who has seen more than people are designed to see and has not looked away. She said, "The boy in 413 is finally down. Rosa is asleep in the chair beside him. They'll make it to 6 before he wakes again if nothing disturbs them." Her voice was quiet. The specific quietness of someone who has spent years practicing the ward's skill of communicating without disturbing the patients on either side of the conversation. Owen said, "Who are you?" She looked at him for a moment with an expression that was neither evasion nor apology. An expression that was simply direct. "I work here," she said. "I know every staff member on this ward. I know you do." She turned back toward the corridor. "Check on Sam before you do your 4 a.m. round. His numbers will start to move before the monitor catches up." She walked away from him down the corridor. He watched her. At the junction where the east corridor met the south wing, she turned the corner and was gone. He crossed to the junction in 9 seconds. He counted them and looked down the south corridor. Empty. The south corridor was 40 feet long and ended at a fire door that had a slow hydraulic closer that produced a reliable 2-second delay between the door being released and the door seating. The door was closed and had the specific stillness of something that had not been moved in the last 30 seconds. No one had gone through it. He went back to the medication cart. He went to check on Sam. Patricia Well had managed Ward 11 for 11 years. She was 56, originally from a small town in rural Ohio that she described, when anyone asked, as the kind of place that teaches you to work hard and not complain about it. She had trained as a nurse in Columbus, worked pediatric medicine in Cincinnati for a decade, and arrived in Portland in her mid-30s following a relocation that she had never fully explained to anyone on the ward, and that nobody on the ward had pressed her about, because the kind of person who applies to manage a pediatric oncology unit is the kind of person whose history you trust, rather than interrogate. She ran Ward 11 with the combination of genuine warmth and uncompromising organizational rigor that the ward required. She knew every child by name and by case, and by the particular things that each family needed that could not be found on a clinical chart. She knew which room needed its blinds tilted at exactly 45 degrees in the morning, so that the light did not hit the child's eyes before they were ready, and which family needed coffee brought to them before they could be expected to receive updates, and which attending physicians responded best to direct communication, and which needed a moment before directness was useful. She had built the culture of Ward 11 with the same deliberateness with which a gardener builds a garden, one decision at a time, each one made from the understanding that the thing you are building will outlast you, and that the people who come after you will either benefit from what you planted or work around what you didn't. She had been hearing about the night orderly for 4 months before she sat down with the staffing records. She had assumed, in the way that busy charge nurses sometimes assume, that the reports were referring to different members of staff at different times, that the accumulated picture of a consistent figure was an artifact of multiple people doing small acts of care that were being compressed, in the telling, into a single character. This was a reasonable assumption. It was wrong. On a Tuesday in November, she closed herself in the charge office with the past 4 months of staffing sheets and cross-referenced every reported action attributed to the night orderly against the names scheduled on those shifts. She had done this kind of audit before. It was the kind of administrative work that reveals patterns, usually unscheduled overtime, usually a staff member doing work outside their designated role, usually something that was either a compliance issue or a commendation depending on the circumstances. What she found was a third category she did not have a name for. Every action attributed to the night orderly had occurred on nights, when the ward's staffing consisted entirely of its regular registered nursing rotation. No orderly, no additional staff, no agency personnel. The tasks, the reposition chairs, the IV adjustments, the visits to children whose pain had spiked, the specific small interventions that fell between the scheduled nursing duties and were attributed in handover to a figure nobody from the overnight shift had formally seen, had been performed by someone who was not on the schedule. She had pulled the badge access records next. Ward 11's staff entrance required a badge swipe for entry after 10 p.m. The access log for the past 4 months showed every staff member's entries and exits, time-stamped and complete. No unidentified badges. No entries that did not correspond to a scheduled staff member. The night orderly had not entered through the badge-controlled door. Patricia sat with this information for a long time. Then she pulled the historical HR records. She had managed this ward for 11 years, and she had hired and lost and transferred a significant number of staff in that time, and she held the memory of most of them in the specific way of a manager who understands that her staff are her primary professional relationship and invests accordingly. But memory had limits, and turnover had layers, and there was a window of about 3 years in the middle of her tenure when the ward's administrative records had been migrated to a new electronic system, and some of the older paper records had not been fully digitized. She searched the name Lily. In the partially digitized records from that window, she found an employment entry. Lily Carver, orderly, Ward 11, hire date corresponding to a Tuesday in March, 4 years ago. An attached scanned photograph, the standard ID badge photo, slightly pixelated from the scanning process, the face of a young woman in her late 20s with blonde hair and blue eyes wearing the pale blue uniform of a Hargrove orderly and looking directly at the camera with an expression that Patricia had seen before on people who worked this ward, the expression of someone who has arrived somewhere they were always going to arrive, and who knew it even then. A termination date. 2 years after the hire date, she clicked on the termination record. The field that normally contained a reason, voluntary resignation, performance restructuring, contained a single administrative code. She looked up the code. The code meant, staff member deceased. Patricia sat very still in the charge office for a long time. Outside, through the glass panel of the office door, Ward 11 continued its night. The amber corridor lights, the sounds of the building, the children sleeping in their rooms down the hall. She picked up her phone and called Owen. He answered on the second ring, which meant he was already awake, which meant the ward had needed him recently. She had learned to read his answering patterns over 7 years. She said, "Are you on the floor right now?" He said yes. "I'm at the North Nurses Station." She said, "I'm coming in. I need you to look at something." She drove to the hospital in the specific early morning dark of a Portland November. The rain that Portland wears as a permanent condition. The streetlights doubled in the wet roads. The city in the particular quiet of a Tuesday at 4 a.m. She parked and badged through the staff entrance and took the elevator to the 4th floor, and walked to the charge office where Owen was waiting with 2 cups of coffee that the ward coffee maker had produced, and that both of them drank without comment, because the coffee on Ward 11 at 4 in the morning was not about the quality of the coffee. She showed him the employment record. She showed him the photograph. She showed him the termination code and the code's meaning. Owen looked at the photograph for a long time, the pixelated badge photo. The blonde hair, the blue eyes, the specific expression. He said, "She told me to check on Sam." She said his numbers would move before the monitor caught up. Patricia said, "Did they?" His temperature climbed 0.8 of a degree in the 40 minutes after I checked him. I caught it early enough to intervene before it became a crisis. He looked at the photograph. If I had waited for my normal 4 a.m. round, the monitor would have alarmed at roughly 4:15. The intervention window would have been narrower. Silence. "Patricia," Owen said. "Lily Carver. What happened to her?" She had looked it up on the drive over. She had the hospital's internal records on her tablet, and she had opened the relevant file at a red light and read enough to have the shape of it. She told him. She had come to Ward 11 through a route that the ward's subsequent staff described as characteristic of the ward's best people. She had not applied through the standard HR process, not initially. She had shown up. Not uninvited, exactly. She had emailed Patricia asking to volunteer, which was a request the ward received regularly from people whose reasons ranged from academic to personal to genuinely vocational. Patricia had interviewed her in the charge office, which was the same chair Owen was sitting in now, and had arrived at the same conclusion Patricia arrived at in most of those conversations, that this person had something the ward needed, and that the ward had something this person needed, and that the correct response to this alignment was to make it official. Lily Carver had grown up in Beaverton, Oregon, the middle of 3 children in a family that was, by her own account, ordinary in all the ways that matter and extraordinary in one. Her younger brother Thomas had been on a pediatric oncology ward for 14 months when he was 6. He had come through. He was 23 now, studying environmental science in Eugene, playing recreational soccer on weekends, demonstrably and specifically alive in a way that Lily had never fully stopped being grateful for. The 14 months of Thomas's illness had been the formative experience of her life, not in the way that trauma is sometimes cited as formative, not as damage or limitation, but in the way of an education so complete and so personal that it had redirected every subsequent decision she made. She had understood at 11 years old, sitting in a ward not unlike Ward 11 in a hospital not unlike Hargrove, watching the people who cared for her brother, that this was work she was going to do. She had understood it with the specific certainty of a child who has seen something that makes the future legible in a way it wasn't before. She had trained as an orderly rather than a nurse, because the orderly role, in her assessment, offered something the nursing role's structure sometimes obscured: the freedom to simply be present, to sit with a child at 3 in the morning without a medication to administer or a chart to update. To hold a hand because the hand needed holding, without the hand being attached to a scheduled task. She had been, by every account from the nurses and physicians who had worked alongside her, extraordinary at this. Priya, who was now 8 and whose medulloblastoma was in a remission that the oncology team was cautiously optimistic about, had told Patricia in a conversation that Patricia had not sought, but had received. "Lily knew when I was scared before I said anything. She would just be there." And then it was smaller, the scared thing. It got smaller. Marcus, who was 12 now and whose lymphoma remained in its armed truce with the treatment protocol, had said, "She told me the names of every kid who had been in my room before me and had gotten better. She said she kept track." She said that was her job, keeping track of the ones who made it. The oncologist who had managed Lily's diagnosis, the stage 3 non-Hodgkin lymphoma, that had been found 18 months after her hiring, at a routine examination that she had almost not attended because the ward had been busy that week and she had felt she could not justify the absence, had told Patricia, in the conversation that Patricia had requested after reading the file, that Lily had been the most difficult patient he had ever managed. Not because she was difficult in the ordinary sense. Because she had refused to stop working. She had received her diagnosis and returned to Ward 11 the following day. She had worked through the first 2 rounds of chemotherapy. She had worked through the fatigue and the nausea with the specific, focused determination of someone who had decided that the work was more important than the condition, and who had the specific background of a person who had watched her 6-year-old brother make this same calculation and had learned from it that the calculation was correct. She had reduced her hours, eventually, because the ward's charge nurse, Patricia, had sat her down and explained, with the combination of warmth and firmness that the situation required, that Ward 11 needed her to still be alive, and that being alive required certain concessions to the reality of stage 3 lymphoma. Lily had listened. She had nodded. She had reduced her hours. She had still come in on her days off. Not scheduled, not drawing pay. Simply present on the ward, in the off-shift hours, because the children were there, and the children were hers in the specific way that the ward's best people understood ownership, not possession, but responsibility. A responsibility she had chosen, and that she did not consider revocable by something as administrative as an illness. She had deteriorated in the final 2 months faster than anyone had wanted. The lymphoma had found resources that the treatment had not closed off, and the progression had been rapid, in the way of rapid things, not fully real until it was fully real. She had been admitted to a room on the 2nd floor, not Ward 11, 2 floors below, because it would have been improper and impossible, and she had known both of these things. On a Monday, she had died on a Thursday. The hospice nurse who had been with her, a woman named Sandra who had been doing end-of-life care for 22 years, and who had developed, over those years, the specific capacity to be fully present at the end of another person's life, without being consumed by it, had told Patricia that Lily had been conscious until the last 4 hours. That she had been, throughout, more concerned with the floor above her than with her own situation. That she had asked, repeatedly, about the children. That Sandra had told her, as truthfully as she could, that the children were being well looked after. That Lily had said, "But are they all right? Is Sam all right? Does Marcus know his counts came back good?" That Sandra had held her hands and said yes, and that some of it was true and some of it was the specific mercy of an end-of-life nurse who understood that a person in their last hours deserves the comfort of the thing they love being safe, whether she had confirmed it or not. That Lily had closed her eyes. That she had said, very quietly, the last words she had sufficient breath for, "I need to check on them." That she had not opened her eyes again. Samuel Okafor was 7 years old. He had been on Ward 11 for 14 months, which was half his remembered life and slightly less than a fifth of his total life, and he had navigated this with the specific adaptability of a 7-year-old, which is to say not well and also remarkably, and also in ways that would require years to fully manifest, and also right now in front of you, in the specific present tense resilience of a child who has not yet learned to fully differentiate between endurance and living, and who therefore sometimes accidentally does both at the same time. His mother, Adiz, had a way of entering his room in the morning that Owen had watched hundreds of times. She came in with the deliberate brightness of a woman who had spent the previous night in the family lounge not sleeping and who had made, somewhere between the first difficult hour and the gray pre-dawn, the daily decision to be bright for him. The decision was visible if you knew to look for it. A slight squaring of the shoulders outside the door, a breath taken in and arranged, the specific performance of a parent who will not let their child see the weight of the thing, because the child is already carrying enough of it from his own side. Sam had the ALL, acute lymphoblastic leukemia, the most common childhood cancer, which was a fact that sounded more reassuring than it felt when the ALL in question had a biology that had responded to the standard induction protocol, and then, at month 9, had found a way around it. The subsequent salvage protocol had produced a response. The response had been partial, and the partial had been a word that carried more darkness in it than its syllables suggested. Owen had known, for 6 weeks, that Sam was approaching a threshold. He had known it with the clinical knowledge of a physician who read the numbers and understood their trajectory, and he had known it with the separate and non-clinical knowledge of a person who had spent 7 years on Ward 11 and who could feel the specific atmospheric change of a room when the room was preparing for something. The formal conversation with Adiz was scheduled for Thursday. On the night of Tuesday, February 2nd, at 2:47 a.m., before Thursday could arrive, Sam's monitor alarmed. Owen was at the nurse's station when the alarm sounded. The sound a monitor makes when something has crossed the critical threshold is distinct from its other sounds. Not louder, necessarily, but carrying a different register, the specific pitch of a system that has run out of its normal ways of communicating and has escalated to the final one. He was on his feet before the sound finished its first cycle. He went through Sam's door in a controlled run, fast enough to be there and slow enough to be useful, which was a distinction that 7 years on this ward had drilled into his body. Sam's oxygen saturation had dropped. His respiratory rate was elevated in the compensatory pattern of a respiratory system, working too hard to maintain a saturation it was losing ground on. His skin had the specific dusky quality that follows a saturation drop and is one of the most urgent things a physician can see in a child. Sam. Owen was at bedside, hands already in motion, mask going on, the oxygen saturation probe being repositioned for a more accurate read. Sam, can you open your eyes for me? I need you to take a big breath, buddy. Can you do that? The nursing staff had heard the alarm. 2 of them were in the doorway within 40 seconds and crossing to the room in the next 10. The organized urgency of a team that had done this before, that had rehearsed this, that trusted each other to move in the right directions without being directed. Sats are 84, the first nurse, Renata, said. Trending down. Get me a non-rebreather mask and call respiratory. Page the fellow on call. Get me the crash cart positioned outside. They moved. Owen leaned over Sam. The child was semi-conscious, his eyes moving under their lids, his breathing the elevated, effortful breathing of someone whose body is working against a deficit it cannot close. His small hands were at his sides on the hospital blanket, and Owen covered the nearest one with his own, which was both a clinical gesture and not a clinical gesture, which was the kind of thing that happened on Ward 11 at 3 in the morning, when a physician had been on this ward for 7 years. I'm right here, Owen said. I've got you. We're going to help you breathe. Just stay with me. The non-rebreather mask went on. The oxygen flow went up. The saturation probe on the new mask placement began its read and the number climbed, slowly, imperfectly, the climb of a number that is going in the right direction without confidence that it will stay there. Adiz was in the doorway. She had heard the alarm from the family lounge where she had finally, 2 hours ago, fallen into the shallow sleep of a person who was too exhausted not to sleep and too terrified to sleep deeply. She had come in the way parents come at the alarm, the specific, desperate velocity of someone for whom the alarm is the worst sound in the world, and who crosses the distance to their child in the exact time the distance permits, no faster, because the distance does not shorten for need. Adiz, Owen said without looking up from Sam. He's with us. His oxygen dropped and we're correcting it. I need you to stay at the door for 1 minute while we work. Can you do that? She did it. That was the kind of mother she was. She did the hardest thing, which was to stand at the door and let the people who knew what to do it. Because the other thing she was, underneath the mother, was someone who had grown up watching her own father practice emergency medicine, and who understood at the cellular level that the 1 minute she was being asked to wait was the 1 minute that made the difference. The fellow arrived. The respiratory therapist arrived. The room filled with the organized, purposeful density of a team working on something that required all of them. The saturation climbed to 89, held, climbed to 91. Owen was watching the number and watching Sam's face simultaneously. The specific split attention of a physician managing a critical patient, holding the clinical picture in one part of the mind and the child in the other part, refusing to let the clinical picture consume the child, which was the practice he had developed over 7 years on this ward, and which was, he had always believed, the difference between good medicine and the other kind. Sam's eyes opened. They opened with the specific, clear quality of eyes that have been somewhere and have returned, not the rolling, unfocused return from unconsciousness, but a direct and deliberate opening, as though the person behind them had decided to come back and had done so with intention. He looked at the ceiling, he looked at Owen, he looked at the foot of his bed, and his expression changed. The expression on Sam Okafor's face was one that Owen had never seen on this ward in 7 years and had, he realized in the moment of seeing it, been seeing fragments of on the faces of children in the deep night, and filing under the heading of dreams. Peace. Complete, undefended, absolute peace. The specific peace of a child who is frightened and has been reached by someone they trust, not the performance of comfort, but the genuine arrival of it, the way a room changes when a parent enters. Sam's gaze was fixed on the foot of his bed with the steady, unblinking attention of a child who is looking at something real. Owen turned. He turned in the way of a person who already knows, on some level, what they are going to find at the foot of the bed, who has been accumulating the evidence for months, and whose body is slightly ahead of his mind in its understanding of the situation. The temperature in the room had dropped. He felt it across his forearms and in the back of his throat, and in the specific chill that enters through the chest when the air has been displaced by something that produces cold not as a temperature, but as a presence. She was at the foot of the bed. Pale blue scrubs. Blonde hair with the 2 clips on the right side. The face from the pixelated badge photograph made present and real and closer than a photograph has any right to be to the thing it represents. The face of Lily Carver, who had worked this ward and loved these children and been in a room 2 floors below this one when she died, and who had, apparently, found her way back to the only place her internal compass had ever pointed. She was looking at Sam. Her face carried the expression he had seen in the photograph and recognized, and not been able to name until this moment. He could name it now. It was the expression of a person who has found the thing they came back for, and is standing in the presence of it, and is, in this moment, more themselves than they have been since the moment they were no longer able to be themselves in the ordinary way. Sam said, "I know you. You sit with me." His voice was clear, clearer than it had been in 3 weeks, the clarity of a voice that has been conserving itself and has decided, for this moment, to spend what it has. Lily Carver looked at Sam Okafor with the specific undivided attention that Owen had heard described by every child she had ever sat with, the attention that Priya had tried to draw and Marcus had tried to describe, and that was, in its full expression, one of the most generous things he had ever seen directed at another person. She said, "I know you too, Sam. I've been sitting with you for a while." "Are you real?" he asked. She considered this with the seriousness that the question deserved. "I'm real enough to be here," she said. "That's the most I can tell you. Am I going to be okay?" The room was very quiet. The oxygen monitor above the bed showed a saturation of 93 and climbing. The respiratory therapist had stopped adjusting the mask settings and was standing very still watching. Renata, at the IV pole, had her hand on the line and was not moving. Adiz in the doorway had both hands over her mouth. Owen watched Lily's face. She reached out and placed her hand, the hand that was cold, that Marcus had noticed was cold, that was cold in the way of things that have crossed the boundary between temperatures and cannot uncross it, over Sam's hand on the blanket. "You have people who love you so much," she said. "You have your mom, who hasn't slept properly in 14 months because she's been here with you, because you are her whole world. You have Dr. Owen who chose to be on this ward because he believes you deserve someone who chooses. You have a whole floor of people who think about you every day." She paused. "And you have me. Whatever I am now, I am on this ward, and this ward is yours, and you are not going through this alone. You hear me? Not one step of it alone." Sam looked at her for a long moment. Then he said, with the directness of a 7-year-old who has been on this ward long enough to understand that directness is the most efficient language, "But, are you staying?" She looked at him. She looked at Owen. Then she looked back at Sam and she said, "I promised I would stay until every one of my kids made it through. I keep my promises." Sam closed his eyes. Not the closing of a child losing consciousness, the closing of a child who has received something that is enough to rest on. He breathed. The non-rebreather mask doing its work, the saturation climbing, the respiratory rate beginning its descent from the compensatory urgency of the past 12 minutes towards something that looked, for the first time tonight, like sustainable. The saturation read 96. Owen breathed. He turned back toward the foot of the bed. She was still there. She had not disappeared in the moment he looked away, had not vanished in the specific theatrical manner of a ghost story that needs its exits to be dramatic. She was simply standing at the foot of the bed the way she had always simply been standing wherever she was when he found her, with the quality of something that had been there long enough to belong. He said, quietly, so as not to disturb Sam, "Lily." She looked at him. "I read your file tonight," he said. "Patricia found it. We know who you are." She absorbed this without visible surprise. "I know," she said. She said your last words were, "I know what they were." Her voice was even. She was not defensive or frightened or evasive. She was simply present, the way she was always present, in the specific fullness of someone who has nothing left to perform. "I needed to check on them. I still need to check on them. That hasn't changed." "Sam is critical," Owen said. "You know that. You've been on this ward long enough to know what his numbers mean." "I know what his numbers mean." "Then you know what comes next." She was quiet for a moment. She looked at Sam, the sleeping child, the oxygen mask, the steady rise and fall of his chest. Her face held the specific expression of someone who is looking at a fact they have known for a long time, and have not let themselves fully look at until now. "He's going to have a hard road," she said. "But the road has an end that's good. I know it does." She paused. "I don't have the clinical data you have. I have something else. I've been with him at 3 in the morning for months, and I know where he's going. He's going towards something, Owen. He's not going away from it." Owen looked at her. He asked, "How do you know?" She considered this with the same directness she brought to everything. "The same way I always knew on this ward," she said. "You pay attention long enough. You stop looking at the numbers and you start looking at the person, and the person tells you." He looked at Sam. The sleeping child, the saturation at 97 now, the respiratory rate at 22, the numbers that were not good but were no longer pointing in the wrong direction. "Abena went home 2 months ago," he said. "She's in full remission." "I know. I went with her family to the elevator. I watched them go. Marcus is stable. His last scan was clean, I know. He showed me. He keeps the scan image on his tablet, and he showed me. The small edge of a smile. He said it was the best picture he'd ever seen." "Priya," Owen said. "Priya is going to be a doctor." Lily said this with the complete certainty of someone reporting a fact rather than a hope. "She told me last week. She said she decided." Owen looked at her for a long time. He said, "Are you all right?" "Whatever all right means for what you are." She considered this seriously. "I'm exactly where I need to be," she said. "That's the closest thing to all right that I know, Lily." He paused. "You're allowed to rest. You know that, right? You don't owe them forever. You gave them everything you had when you were alive. You've given them 2 years more. Whatever the debt is." "It's not a debt," she said. Her voice was quiet and completely certain it was never a debt. "These kids are mine, not because of obligation, because of love. You can't put a limit on that and then rest. The limit is when they're okay. When they're all okay, or as okay as this ward can make them." He looked at Sam. "That might be a while," he said. She said, "I've got time." That a days Okafor had known from the first week. She would tell Owen this later, in the family room, in the gray early morning after the crisis had passed, and Sam was stable and breathing, and the numbers had settled into something that was still serious, but was no longer sounding every alarm in the building. She told him with the matter-of-fact quality of a woman who had spent 14 months on this ward, and had developed, in that time, the specific attunement to its rhythms that only the parents of long-term patients develop. "The first night I noticed her," Adiz said, Sam was having a terrible night. High fever, pain that wasn't responding well to the medication. The kind of night where you lie in the chair beside his bed, and you listen to him breathe, and you count his breaths, and you try to make the counting a prayer. I must have fallen asleep for an hour. When I woke up, Sam was quiet. Actually quiet, the peaceful kind, not the exhausted kind, and the room was cold. And there was a smell." She paused. A smell that I couldn't place exactly. Clean. Like a room that had just been aired out, but the windows don't open on this floor. She was there, Owen said. She was there. Adiz held her coffee with both hands. I didn't see her that first time. But I knew. The way you know when someone has been in a room. The quality of the air, the sense that the space has been occupied by a presence that cared about what was in it. She looked at her hands. I've spent 14 months in a ward that is full of people who care about my son. I know what care feels like in the air of a room. This was that. Why didn't you say anything? She looked at him with an expression that was both gentle and direct. Because she was helping him, she said. Whatever she was, whatever the explanation was or wasn't, she was helping my son sleep through a bad night. What was I going to say? Stop. Owen was quiet. There's a specific thing that happens, Adiz said, when your child has been sick for long enough that you've stopped being shocked by the things that fall outside the ordinary. You stop evaluating comfort by its source. You just receive it. And what she gave him every night she was there, it wasn't supernatural to him. It was just Lily, the lady who sits with him. He trusted her the way children trust people who have proven they will stay. The sun was beginning its arrival over Portland outside the family room window. The specific gray gold of a February morning in the Pacific Northwest. The light that comes through clouds is a quality of the air rather than a direct illumination that makes the city look as though it is being remembered rather than observed. She said Sam is going towards something good, Owen said. Adiz absorbed this. She looked out the window. I believe her, she said simply. By the time the day shift arrived at 7, Sam Okafor was stable. His saturation was holding at 95 on supplemental oxygen. His fever had reduced by 1.5 degrees. His pain score, when the morning nurse asked him, was a 4, not good, but 4 was a number that had a protocol attached to it, and the protocol was being implemented, and Sam had reported the 4 in the direct, collaborative tone of a child who had been on this ward long enough to understand that accurate reporting was the most useful thing he could do for the people trying to help him. The oncology fellow had reviewed the overnight chart and the crisis documentation and the intervention notes and had said, in the morning briefing, this is a child who came to the edge of something last night and came back. I want to understand why he came back as thoroughly as I want to understand why he went to the edge, which was, Owen thought, exactly the right way to frame it. Patricia had arrived at 6:30. She had driven back in the same pre-dawn Portland rain and come directly to Owen in the corridor outside Sam's room, and he had told her what had happened. And she had listened with the expression of someone who has spent 4 months assembling a picture and has just received the final piece, and is now standing back to look at the complete image. She said he's going towards something good, Owen told her. Patricia looked through the glass of Sam's room at the sleeping child, at Adiz in the chair beside him with her eyes closed and her hand wrapped around his, at the numbers on the monitor that were still serious, but were not what they had been at 2:47 a.m. She knew this ward, Patricia said. She knew these kids. She knew when something was going right and when something was going wrong, and she was right more often than the monitors were. Pause. If she says he's going towards something good, I don't think that's supernatural. I think that's a woman who paid closer attention than anyone else and is telling us what she sees. Owen thought about this. When she's not there, he said. When she's not in the room is different. It's just a room. It has everything a room on this ward has. The equipment, the staff, the care, and the children are looked after. But the specific quality of the room when she's present, I know, Patricia said. I've felt it. In the morning when I come in after her nights. The ward has a quality in the morning after she's been here. Like a room that has been prayed in. They stood in the corridor for a moment. We can't put her in the scheduling records, Patricia said. We can't document her. We can't brief the new staff on her without losing them. A pause. What do we do? Owen thought about it honestly. We do what we've been doing, he said. We work this ward the best we know how. We let her do whatever it is she does. And we try to be the kind of place she chose to come back to. Patricia looked at him. She chose this ward, she said, because of the people on it. She came back for the same reason. He nodded. Then we keep being those people, she said. That's the whole answer. 6 weeks after the night of Sam's crisis, Priya was discharged. Her medulloblastoma was in a deep remission that the oncology team described with the careful, provisional optimism of people who have been burned by premature certainty and who express their best hopes in the grammar of statistics and percentages, while privately and individually feeling something that the grammar of statistics does not fully accommodate. She left on a Tuesday morning in March when the Portland rain had lifted and the sky above the hospital was the specific washed blue of a day that has decided to be clear for the first time in weeks. Her father carried her bag. Her mother carried her, even though she was 8 and had opinions about being carried, because her mother needed to carry her, and Priya understood this and allowed it with the specific grace of a child who has been on this ward long enough to understand what her parents have been carrying. She made Owen a drawing before she left. She presented it with the formal seriousness of an 8-year-old presenting something she had made for someone she respected, which is the most unambiguous form of honor a person that age has available to them. The drawing was of the ward, the corridor, the rooms, the amber nightlights rendered in orange crayon, the shapes of the beds visible through the drawn rectangles of the doors. In the corridor, 2 figures, one tall and dark with a white coat, which Owen understood to be himself. One smaller, in blue with yellow hair. She had labeled them both Dr. Owen, Lily. He looked at the drawing for a long time. She told me she's proud of me, Priya said, for getting better. She said, I worked really hard. You did work really hard, Owen said. She also said she's going to check on me, Priya said, with the confident nonchalance of a child reporting a made appointment. When I'm back for my follow-up. She said she'll be there. Owen folded the drawing carefully. I'll make sure we keep a chair free, he said. Priya considered this. She doesn't really need a chair, she said. She usually just stands. She says standing is fine. Then Priya's father was in the doorway with the bag and Priya's mother was right behind him, and Priya turned to go and then turned back once, the way children turn back once, for the specific reason that they want one more look at the thing they are leaving, and then she walked down the corridor toward the elevator and the rest of her life. Owen watched her go. At the end of the corridor, near the elevator, the air did something. He could not describe it precisely. It was the quality of air near an open window when there was no window open, the specific quality of a space being inhabited by something that was, and was not there at the same time. He felt the edge of the cold, not the full cold, the edge of it, the way the edge of something warm is detectable even after the warm thing has moved away. He raised his hand, not to anyone who was visible, to the end of the corridor. To whatever or whoever was watching the elevator door close on Priya and her parents, watching one more child make it through, keeping the count she had promised to keep. He held his hand up for a moment. Then he lowered it and went back to his charts. Sam Okafor was discharged on a morning in late April. The discharge came at the end of a 3-week period that the oncology team would document as a remarkable response to a modified salvage protocol, remarkable being one of those clinical words that carries the weight of what it is not saying, which is, we did not expect this and we are grateful, and we are also, privately, unable to fully account for the trajectory. He walked out under his own power. This was the specific achievement that the Ward 11 staff marked because it was the most visible one. A child arriving on a stretcher and leaving upright and moving, which was the whole point, the entire purpose of every night and every decision and every difficult conversation in every room on this floor. Adiz held his hand the whole way to the elevator. Owen was in the corridor. Sam stopped. He looked at Owen with the specific, unguarded directness of a child who has been in the company of adults at their most serious for 14 months, and who has learned that directness is the correct register for important things. Is she going to be okay? Sam said. Owen understood the question immediately. What makes you ask? She stays because of us, Sam said. Because she's worried about us. But if we're okay, he thought about this with visible effort. The effort of a 7-year-old trying to hold a large and complex feeling and turn it into words. She should be able to rest, right? If her job is done. Owen crouched down to Sam's level. He looked at him. Her job, Owen said carefully, is to stay until every one of her kids makes it through. That's what she said. I made it through, Sam said. You did. And so did Priya, and Marcus. And Abana. Then she can rest, Sam said. He said it with the simple, certain authority of a 7-year-old who has decided something and is not in the habit of reversing his decisions once made. Tell her we're okay. Tell her she can rest now. Owen looked at him for a long moment. I'll tell her, he said. He straightened. He watched Sam and Adiz walk to the elevator. The elevator doors opened and they stepped inside, and Adiz looked back, and her face did the thing his mother's face had done when he left home for the first time. A look of such complete, specific love that it was briefly painful to look at. And then the doors closed. He stood in the corridor. He said to the ward, to no one visible, in the tone of someone leaving a message for a person they trust to receive it. They're okay, all of them. They made it through. You kept your promise. He paused. You can rest now. The ward was quiet. The amber night lights ran along the baseboard. The monitors in the occupied rooms kept their rhythms. The building breathed around him in the specific way it breathed at this hour. And then the temperature dropped. One last time. Not the sharp cold of an arrival, but the slow, settling cold of something coming to rest. The cold of completion. The specific chill of a room, when the last piece of a very long task has been placed in its position, and the task is done. It lasted 30 seconds. Maybe less. When it lifted, the corridor was warm and the lights were steady, and the ward had the quality it had every morning after she had been there. The quality Patricia had described as a room that had been prayed in, the quality of a space that has been fully inhabited by love and has retained the warmth of it. Owen stood in it for a while. Then he went to write his charts. In the months that followed, the new staff on Ward 11's overnight rotation did not report the night orderly. The cold temperature drops did not recur. The chairs were where they had been left the night before. The small, unscheduled acts of care that had been arriving from outside the staffing schedule stopped arriving. Lily Carver had clocked out, but the ward did not become a different place without her. The culture she had inhabited and embodied, the specific devotion to presence over procedure, the willingness to be in the room with the difficult thing, the belief that a child on this floor deserved someone who chose to be here, rather than merely placed here, remained in the building the way a teacher remains in the work of everyone they taught. Not as a ghost, as a practice, as a way of moving through the ward that the people who had worked alongside her had absorbed and carried forward, without being able to name the specific moment they had learned it. The new orderly who joined Ward 11 in June had been told by Patricia in her hiring interview that the ward had a particular culture and that the culture was the job's most important qualification. She had been told, the work here is presence, not tasks. Presence. The work is being genuinely, undefendedly present for the children in these rooms in a way that puts the child's reality first and your own comfort second, and the children will know the difference, and so will the people working alongside you. The new orderly, her name was Bae. She was 26. She had a younger sister who had been on a pediatric oncology ward for 11 months when she was 9, had said, I understand. She had said it in a way that Patricia recognized. The way of someone who has already been educated by the thing they are being told about. She was right for the ward. She would be good here. In room 413, a 4-year-old named Rowan was in his second week of treatment, and his mother was in the chair beside him every night. And the ward was doing what it had always done, which was to be present, completely and without reservation, for the people inside it. Some duties are inherited. Some presences leave behind more than an absence. Lily Carver had promised to stay until every one of her kids made it through. She kept her promise. Then she rested. The ward carries her name in the way that important places carry the names of the people who loved them into their finest hours. Not on a plaque, not in a record, but in the quality of the care, in the way an orderly pulls a chair close at 3 in the morning, in the way a physician crouches down to speak at eye level, in the way a charge nurse builds a culture around the premise that these children deserve people who choose. Ward 11 remembers her. Every morning it opens its doors. Every night it keeps its watch. If you love this type of intense nurse-taking action tales, hit that like button. Share the video with your fellow thrill seekers, subscribe to our channel, and ring the bell so you never miss a new story.